Hello, I'm Dr. Ohana Smith. I've spent many years working with seniors just like you, helping to keep you healthy and strong. Over the years, I've learned that our bodies are incredibly smart. They send us signals when something is not quite right. Sometimes these signals are small and easy to ignore, but other times, they are loud and clear. These warning signs can be telling us that something serious is happening inside, and it's important not to ignore them. Have you ever noticed a strange feeling or pain in your body and wondered if it was serious? Some symptoms might seem harmless at first, but the truth is, they could be your body's way of saying, something is wrong. Doctors know these signs, and they can help us figure out what's happening before things get worse. In this video, I'll talk about 6 warning signs that could mean you're in serious trouble. These signs might seem small, but they could save your life if you pay attention and act quickly. Sign 1. Unexplained extreme fatigue. We all get tired from time to time, especially after a long day, or if we haven't had enough sleep. But there's a big difference between normal tiredness and feeling exhausted for no reason at all. If you're feeling unusually tired, even after a good night's sleep, or if everyday tasks like getting dressed, walking, or cooking suddenly feel too much to handle, it could be a sign of something serious. This kind of tiredness is more than just feeling sleepy or worn out. It can make you feel weak and drained all the time, even when you're not doing anything difficult. This isn't just part of getting older. It could be a sign that something inside your body isn't working right. Sometimes, it could mean that your heart, kidneys, or other important organs are struggling. If you used to have energy, but now find yourself feeling exhausted without any good reason, it's time to talk to your doctor. Sign 2. Sudden and severe. Chest pain or pressure. Chest pain can be scary, and it's something that should never be ignored. If you suddenly feel a heavy or crushing pain in your chest, especially if it spreads to your arms, neck, jaw, or back, it could be a sign of a heart attack. It might feel like a weight is sitting on your chest, making it hard to breathe. This kind of pain is a serious warning that something is very wrong. Don't ignore it, even if you think it might just be heartburn or muscle strain. Chest pain like this can also be a sign of a tear in your heart's biggest artery, called an aortic dissection, which can be fatal. If you experience this kind of pain, don't wait. Call for emergency help right away. The sooner you get medical care, the better your chances of survival. Sign 3. Difficulty breathing or shortness of breath. It's normal to feel out of breath after physical activity, like climbing stairs or exercising. But if you suddenly feel like you can't breathe well even when you're sitting still, that's a big red flag. Sometimes, people might feel like they can't get enough air, as if the air around them is too thin, no matter how hard they try to breathe in. This feeling is not something you should ignore, because it can be a sign that something serious is happening in your body. If you have trouble catching your breath suddenly, it might mean that your heart or lungs are not working as they should. One of the common causes of shortness of breath is something called pulmonary embolism, which is when a blood clot travels to your lungs and blocks the blood flow. This can make it hard to breathe and sometimes can feel like you're suffocating. Another reason you might feel short of breath is congestive heart failure, where your heart isn't pumping blood properly, causing fluid to build up in your lungs. This can make it feel like you're drowning in your own fluids, even when you're lying down. Some people even experience sudden breathlessness during the night, sometimes waking up gasping for air. Other causes can include lung infections, asthma, or other serious problems like a heart attack. While many people think shortness of breath is just something that comes with age, it's important to remember that it can actually signal something dangerous. If this happens to you, don't wait. Sit down, try to stay calm, and get medical help right away. Don't just assume it will go away on its own. Early treatment can be life-saving. Sign 4. Drastic and unexplained. Weight loss. Losing weight can seem like a good thing at first, but if you're losing weight unexpectedly, without trying, it's actually a cause for concern. For example, if you're eating the same amount of food as usual, but your clothes are suddenly too loose, or people are noticing you look thinner, it could be a sign of something wrong inside your body. Many people think that weight loss is just a part of aging, but it's actually something you shouldn't ignore. Sudden weight loss can often be a sign that your body is dealing with a serious condition like cancer. Cancers, especially in areas like the lungs, pancreas, or digestive system, can cause the body to burn through calories at an alarming rate without you realizing it. But cancer isn't the only cause. Weight loss can also happen if you have diabetes, heart failure, thyroid problems, or even infections that your body is fighting off. Sometimes, when your body is fighting an illness, it uses up energy quickly, causing you to lose muscle and fat, which makes you feel weaker. It's important to pay attention if your weight has dropped without any changes in what you're eating or how active you are. If you've lost more than 5% of your body weight in a short time, that's a serious warning sign. Don't assume it's just part of getting older. Make sure to visit your doctor to find out what's happening and to get the right treatment as soon as possible. Sign 5. Confusion, disorientation, or sudden personality changes. If you or someone you love suddenly begins acting confused, forgetting things, or behaving in a way that feels unusual, it can be a very worrying sign. These changes are not just part of getting older, and they shouldn't be brushed off as normal. Sudden confusion or disorientation can point to something much more serious going on in the brain. One of the most concerning causes of sudden confusion is a stroke. A stroke occurs when the blood flow to the brain is blocked, leading to damage. The symptoms can be different depending on which part of the brain is affected, but common signs include sudden confusion, difficulty speaking, trouble understanding others, or even a loss of memory. In some cases, people may experience what's called a transient ischemic attack, TIA, often called a mini-stroke. This is when the symptoms of a stroke appear for a short time, maybe for a few minutes or hours, and then go away. However, a TIA is a warning that a full-blown stroke could happen in the future, so it's essential to take it seriously. Another possible cause of sudden confusion is an infection in the body, especially in older adults. When the body is fighting off an infection, it can sometimes affect the brain, causing confusion or disorientation. This can happen with urinary tract infections, UTIs, pneumonia, or other illnesses. Infections like these are very treatable, but if they are left unchecked, they can cause further harm. It's especially important to be aware of confusion or personality changes in older adults, as they are more vulnerable to infections affecting their mind. Sudden memory loss or confusion can also be a sign of Alzheimer's disease or another form of dementia. While these conditions usually develop slowly over time, sometimes a person may experience a rapid decline in their memory and behavior. They may forget things they just learned, mix up familiar places or faces, or act out of character. These changes can be very frightening for the person experiencing them and for their loved ones. If you notice these signs in yourself or someone else, it's important to see a doctor as soon as possible. Early diagnosis can help with treatment, and there are steps that can be taken to improve quality of life. If you notice that you or someone close to you is confused, forgetful, or acting differently, don't wait. It's always best to see a doctor for a full evaluation. The sooner you seek medical help, the better the chances are of finding out what's causing the problem and getting the right treatment. Sign 6. Severe and persistent abdominal pain. Many of us experience stomach aches from time to time, especially after eating a heavy meal or having a little too much rich food. However, if you experience severe, sharp pain in your stomach or abdomen that doesn't go away, it could be a serious warning sign that something is wrong inside your body. This kind of pain should never be ignored. One of the most dangerous causes of severe abdominal pain is a ruptured abdominal aortic aneurysm. The aorta is the largest blood vessel in your body, and it carries blood from your heart to the rest of your body. Sometimes, part of the aorta weakens and bulges out, forming an aneurysm. If this aneurysm bursts, it can cause life-threatening internal bleeding, and the pain is often described as a deep, sharp ache in the stomach area. It can feel as though it's pulsing with every heartbeat, and it's a medical emergency. If you experience this kind of pain, it's essential to get to the hospital immediately. Another cause of severe abdominal pain is intestinal blockage. This happens when something, like a twisted bowel or a blood clot, blocks the intestines. The pain can be intense, and the stomach might feel swollen or hard to the touch. If you have trouble passing gas or going to the bathroom, this is a warning that the intestines are not working as they should, and it can be very serious. If left untreated, it can lead to further complications like infection or damage to the intestines. Pancreatitis, which is inflammation of the pancreas, is another possible cause of severe stomach pain. The pancreas is an organ that helps digest food and regulates blood sugar. When it becomes inflamed, it can cause sharp pain in the upper abdomen, sometimes spreading to the back. This pain may get worse after eating, especially fatty foods, and can be very difficult to bear. If you experience this kind of pain, it's important to get medical help quickly, as pancreatitis can lead to serious complications if not treated. Finally, gallbladder attacks can cause sharp stabbing pain under the ribs, usually after eating foods high in fat. The gallbladder is a small organ that helps with digestion, but sometimes it can become inflamed or blocked by stones. This can lead to severe pain, nausea, and vomiting. If you feel this kind of pain, it's important not to assume it's just gas or indigestion. It could be a sign of a serious problem that requires medical attention, like an infection or blockage. If you experience severe abdominal pain that doesn't go away, or if the pain is accompanied by other symptoms like fever, vomiting, or weakness, you should go to the doctor right away. Delaying medical care can make the problem worse, so it's always better to be cautious and get checked out. It's important to remember that your body is always trying to communicate with you. If you notice any of the warning signs we've discussed, like confusion, sudden personality changes, or severe abdominal pain, it's essential to take them seriously. These symptoms can be signs of something serious, like a stroke, infection, or life-threatening conditions like a ruptured aneurysm or pancreatitis. By paying attention to your body and seeking medical help early, you can protect your health and improve your chances of getting the right treatment. Don't ignore these warning signs, even if they seem minor at first. It's always better to be safe and get checked out by a doctor. Taking action quickly can help you avoid more serious problems down the road. So if you notice any of these signs, don't wait. Seek medical help right away. By doing so, you're taking control of your health and ensuring that you get the care you need to stay strong and healthy.